In Virginia and across the nation are calling for beefed up mental health services right now.
Yeah, the General Assembly gave $1.5 million this year to start crisis services across Virginia, but Hampton Roads didn't get any of that money, and neither did Northern Virginia. Today, I spoke with the new coordinator of youth mental health services in Virginia Beach, who is fighting for funding here. While the tragedy in Newtown, Connecticut brought the country to tears, it also brought many to their feet.
It just really made me even more dedicated to trying to build these crisis services.
Jim Thornton believes there's a gap in Virginia's mental health care system that must be filled.
The sad truth is, on a given day, if somebody wants to take a gun and commit as much mass harm as they can and take their own life, there's not much that's going to be able to be done on that particular day to stop them.
Stopping them, he says, takes early intervention, like the paranoid and aggressive 16-year-old he was assigned to near Lynchburg a decade ago.
He ended up having an arsenal of weapons in his bedroom, and he became very upset when I started discussing with his parents about the fact that I didn't feel like he was safe to have these guns.
The boy's parents not only knew about the guns, they had given most of them to their son as Christmas and birthday gifts. Thornton got a court order to have them removed.
I truly feel, based on the work that I did with him, that he was probably one negative life event away from actually imitating some of this type of behavior that we're seeing.
Thornton explained children on Medicaid can get crisis services, but families with private insurance have two choices: hospitalization or outpatient care, which usually is a couple hours a week. He is writing a proposal now asking the state for ongoing funds to provide crisis services for everyone. He estimates the cost at about $3,000 a month per child, a cost that could never compare to a loss such as this. Lawmakers start budget talks in just a few short weeks. Thornton's office is asking for $745,000. It would include some overnight beds for mental health services, as well as mobile crisis teams similar to the one he began in Lynchburg. It would be based in Virginia Beach and then used as a model for the rest of Hampton Roads.